And hello, it's Friday, and that means it is time for our Lunch and Learn. And I look not centered on my camera here, so I'm gonna try and center me up a little bit better. That's better. I think that's a little bit better. Anyway, welcome. This is your Friday Lunch and Learn with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness. Now, we are in downtown Humble at the corner of Avenue C and Main Street. And thank you guys for tuning in. I appreciate that. If we lose the connection, I will reconnect, so try and find me again. But we're going to be having quite a few little conversations today. And so I'm going to start with the gut brain heart connection here. So one of the things that we're looking at is the herbs that work on the gut brain heart connection. And so a lot of people don't know that there is something called the ripple effect. And we've done this graphic before, and I just got out of an appointment, so I don't have it with me, but we'll post it on the page. But there is the ripple effect graphic that we have, which is if the digestion is good, if the stomach is good, if the biliary tree is good, that's your gallbladder, your liver, your pancreas, all that is good. You're digesting your food, you're absorbing your food, then you're going to have really, really good health because you're going to absorb all your nutrients, you're going to repair and replenish the body, and you're going to have health. If the biological terrain in the gut, and that is your stomach, your small intestine, your large intestine, the gallbladder's not working, you don't have a gallbladder, you're not supplementing properly, all of those things are not working properly, then you're not going to have a good gut, brain, heart connection. If you don't have that, then you're not going to be well. So one of the supplements that, we're going to talk about some different supplements, some herbal supplements that are going to help you on that, but I want to read to you from this study, right? How many of you knew that serotonin, now serotonin is one of those neurotransmitters that help us sleep, right? Serotonin, neurotransmitters in the brain. So you think that the serotonin is all in the brain, but your gut makes most of your serotonin. So if your gut microbiome is not right, you're not going to have that serotonin there. So that's just kind of an interesting thing. Berberine, and I've got some berberine right here, okay? This is... it's berberine intrinsic. It's got barberry, golden seal, golden thread, green tea, some kind of bark, an Oregon grape, plus berberine. So this is really, really good. It's got all the cofactors. We talked last week about cofactors. So this is something that we have. Hey, Sandy, all the way from Alabama. Thank you so much. Berberine positively affects the gut and the heart. So it is found in many plant sources. It's also known for helping to promote gut microbiotic balance. As a matter of fact, researchers have renewed interest in these plant substances because of bacterial management in the gut. Berberine is the leader of the pack, right? It also is a botanical commonly known to influence blood sugar, blood lipids, and the immune system. So let's talk about blood sugar, blood lipids, and the immune system. What is blood sugar? Well, if you don't have good blood sugar management, you're going to have either type 2 diabetes or you're going to have hypoglycemia, right? So we don't want to have that. If your blood lipids are out of balance, what are you going to have? You're going to have high cholesterol, which we don't want to have either. So berberine helps to metabolize those things. So I'm going to give you some statistics here. According to a 2016 study, the gut's immune system is as an important contributor to metabolic disease. What is metabolic disease? Metabolic disease is when you can't lose weight. You diet, you exercise, but you're just not able to lose the weight. So I know that affects a lot of us. It may be a therapeutic target when looking at systemic inflammation and insulin resistance. So if you have insulin resistance, what are you going to have? You're going to have diabetes. You're also going to have PCOS, polycystic ovary syndrome, and there's a lot of other things that can happen too. So altered gut immunity is associated with changes to the gut microbiota, intestinal barrier function, gut residing immune cells, and tolerance to antigens. Now, an antigen is something that the body makes as a response to an allergy. So if you're not able to respond to that, what's going to happen? You're going to head toward autoimmune disease. So this is really, really important. So there's a study in 2015 for the Centers of Disease Control and Prevention that reports that over 30 million Americans have diabetes, right? 3 times that many are pre-diabetic. So our diet, the standard American diet, has a big contributing factor. It is a big contributing factor to the way that we eat. So, or the way that we metabolize our food. So we don't want to have that SAD, standard American diet, right? We want to see that what we can do to take care of that. So as that was a 2015 study. There's a study that 2012 that saw that berberine was really, really important to managing metabolic syndrome. So this is what we don't really talk about because nobody really understands metabolic syndrome. We think of it as yo-yo dieting, which yo-yo dieting does contribute to that. It can be glandular. It can be you're just not metabolizing the food the way you need to. So hey Kim, I'm waving at you too. Thank you so much. Okay, so how does berberine help the heart? This is in, let's see, one study produced significant reduction to total cholesterol, triglycerides, and LDL, right? With a marked increase in the HDL. Now, LDL is quote unquote the bad cholesterol, whereas HDL is quote unquote the good cholesterol. So berberine in the diet, berberine as a supplement causes your bad cholesterol to come down. What is bad cholesterol? If you remember from previous conversations, your bad cholesterol is a response to inflammation. So somehow the berberine stops the inflammatory process. When the inflammatory process is low, you're not going to need the bad cholesterol. So remember, every symptom is a healing strategy. We don't want to just attack symptoms. In traditional Chinese medicine, that's called chasing the dragon, right? When you go into your doctor, the doctor's going to say, what's wrong? And you're going to say, I have no libido, I can't lose weight, I have a sinus infection, or whatever you're going to say. They're going to prescribe you a pill to make the symptom go away. The pill does nothing to help with the cause of the symptom. And so that's what we do in holistic world is we find the cause of the symptom, we get the cause under control, then the symptom goes away because your body doesn't need to notify you that you have a problem, okay? So this is really, really important. One cell looked at the use of berberine in both human cell cultures. This is in vivo and in vitro, so in the petri dish and then actually in the people, to determine how berberine worked on your pre-adipose tissue. This is your fat tissue, right? And so this showed that in just a few months that the subjects showed a decrease in their BMI and in their leptin, and I can't say this other word, ratio, suggesting that berberine may improve insulin sensitivity by inhibiting fat storage as well as having beneficial effects on the control of lipid levels. So What is fat storage? Well, that's where the body takes your fat that you can't metabolize and it pushes it into your fat cells because it doesn't know what to do with it, and then you get heavier. So when your BMI, your body mass index, is reduced, then you're able to move forward with weight loss goals and that kind of thing. So this was very, very significant. The authors concluded in this study that berberine is effective in its support of the cardiovascular system and in the maintenance of healthy blood sugar levels with no adverse reaction in any of the studies. Berberine has also been shown to inhibit complex 1 of the mitochondrial respiratory chain, resulting in an increase, and then it gives you all these big polysyllabic words that we're not going to even try to pronounce on live Facebook video. Okay, so you're just gonna have to take my word for it, or we can post this study on the web. Anyway, it also contributes to energy at the cellular level. So what does that mean? That means you're gonna feel better, you're gonna have more energy, you're gonna lose that body mass index, and you're going to be metabolizing your blood sugar properly. You're going to be metabolizing your blood lipids properly, which is awesome. So consider the benefits of neurological health, right? The dopamine. So we talked about serotonin being made in the small intestine. Dopamine is another feel-good neurotransmitter. Berberine has shown that the potential for controlling seizures, diabetic-induced memory dysfunction, and hyperexcitability. One animal study investigating obsessive-compulsive disorder found berberine to promote anti-compulsive and or anti-anxiety effect due to its ability to increase the neurotransmitters. So, that's a mouthful, right? Dopamine is a neurotransmitter that is in low supply with people that get Parkinson's disease and they have tremors and that kind of thing. So berberine increases the dopamine effect in the brain, which causes you to be less stressed, causes you to have less anxiety, causes you to have less seizure. So this might be if you have children that are on the ADD, ADHD, you might want to think about adding a little bit of berberine to their supplementation to see what happens. So that might be something that we think about. This is just really, really funny. How do they look at animals in a study for obsessive compulsive disorder? I don't really know. I'm not the scientist here. I'm just reading the report. But apparently animals can be obsessive compulsive too. I've never had a neurotic animal, so I don't really know about that. But if it works in the animals, it probably will work in us as well. Okay, so that's just really, really important. So berberine has found its role in the gastrointestinal, cardiovascular, and brain worlds. Now, there is a caution. I'm going to give you a caution to this. You want to be very careful about the kind of berberine that you pick, and you want to make sure that you're not taking any medicines that this can be contraindicated with, okay? Berberine can cause some gastrointestinal discomfort, so you want to take a small dose. You want to take it with food. If you are having any kind of liver dysfunction, if you're taking any kind of liver prescriptions, then you might want to think twice about doing berberine. So just going to throw that out there, okay? That's why you have a professional who can help you with that. So we do have the berberine, and it's awesome. So we're going to talk about low testosterone now for all of our male friends. So we all know about menopause, and there is another pause that's called andropause. And the actual meaning of andropause, it comes from a Greek word, andros meaning human male and pause meaning cessation. So andropause means to cease being male. So, I mean, who wants that? I mean, oh my goodness, we don't want our men to quit being men. And so this is a real thing. It does happen to men women have a sign in their body. They quit having their monthly periods when they're in menopause. Men don't really have that because they don't have a monthly sign, if you will. And so we need to figure out what's going on with them. So what normally happens in andropause is that you have reduced testosterone level. The common parlance is low T. And there are all these kind of androgel, all these kind of prescriptions out there that you can be prescribed. And I have looked at these, and I have looked at the cautions, and some of these things they put on their underarms and that kind of thing, and they say, do not hug your wife while you've got this on because it can really mess up her hormones. And there's some other negative effects of that. And so you've got to be really, really careful if you do these products. And so I'm very, very cautious with these prescriptions because of that reason. But here are some of the symptoms to know that you are in andropause. Night sweats, decreased libido, dry hair, dry skin, trouble concentrating, muscle loss, insomnia, anxiety, or irritability, okay? Reduced bone integrity, insulin resistance, okay? So remember, this is called ceasing to be male, right? And so we don't want to do that. So men have testosterone. We all have the same hormones. We all have estrogen, progesterone, and testosterone. These are our sex hormones. The women have more estrogen and progesterone. My computer is blinking at me because I'm not looking at it, so I'm going to turn its face so you're not seeing that blinking. Women have more estrogen and progesterone. Men have more testosterone. They still have estrogen. They still have progesterone as well. They just don't have as much as we do. Now, if they have the low T, that can be for a number of reasons. And so we're going to talk about that right now. So testosterone can act as 3 different hormones. It can act as testosterone, which is what gives the male his erection and that kind of thing, which we absolutely love. It can also act as estrogen if it's messed up, and it can also be a signaling molecule if it's messed up to cause your other endocrine glands not to work properly. So this can be a really, really big deal. So testosterone is essential in maintaining libido, fertility, healthy weight, bone health, and general well-being. Y'all quit laughing at me. I'm just reading this report here, okay? Symptoms of low testosterone. They are very subtle. They can be very slowly developed, and they may not even know. Now, one of these symptoms is hypogonadism. Now, hypo means low or small, right? Low or small. Gonad is your testicles, because this is a man. So I guess one of the signs is that you have your testicles start to shrink. So we don't want to kind of go there, but that's what it says. Okay, so low testosterone levels may be a biomarker for an underlying condition. So studies have shown that low testosterone levels can be accompanied or associated with obesity, insulin resistance, and dyslipidemia in men, okay? So dyslipidemia, that means your cholesterol is out of balance, okay? Conversely, men with metabolic syndrome and type 2 diabetes have a higher prevalence of hypogonadism. So this is a good reason for you to take care of your blood sugar because you don't want your testicles to shrink. So I'm just throwing that out there. Okay, so thanks Kim, I appreciate that. According to the British Medical Journal, right, the best estimate of the prevalence of low T comes from the European Male Aging Study. Measuring a combination of sexual symptoms and testosterone levels, they found that only 0.1% of men in their 40s, 0.6% of men in their 50s, and 3.2% of men in their 60s 5.1% of men in their 70s would meet the criteria of a low T diagnosis. Now, this is really surprising to me because we hear commercial after commercial after commercial on the low T issue. So what is behind that? Are they just trying to sell these prescriptions, or is this something that is a result of something else? I think it's a result of something else, and this is what I think. Okay, I don't know if you care what I think, but it's my show, so I'm going to tell you. We have a environment that is full of xenoestrogens. Xenoestrogens mimic real estrogen. So, as I said earlier, men don't have that much estrogen in their body. They've got mostly testosterone, a little bit of estrogen, but there's estrogen in our water because people are throwing their prescriptions down the toilet and it gets in our water supply. You know, believe me, you can check it out. Even though the water is purified, it's purified for contaminants that are bacterial. They're not necessarily purified for contaminants that are chemical. We also are microwaving food. We're also drinking out of plastic bottles. We're also having cans that are not lined with, or that are lined, with BPA liners. So you're getting this estrogen, these xenoestrogens, xeno meaning false or foreign, estrogens into the body. So when this estrogen is in the body, and it's this chemical synthetic estrogen, not a real, hormone estrogen, what it does is it binds to those hormone receptors and it turns testosterone into, I call it wimpy testosterone, but the actual word, let me see in my report if I can find the actual word. It's where's my actual word? I'll find it in a minute. Anyway, it's called wimpy testosterone, okay? And so what that does is it takes the testosterone from the chemical makeup that it is supposed to have, turns it into wimpy, which leads to gynecomastia. How do you like that word? That's the proper medical word, and you hear this on the television commercials. If you have low T, then you're going to have gynecomastia, and what that means is you've got man boobs, right? And so if you are having trouble, your breasts are growing as a man, you could have this wimpy testosterone. So we want to get the testosterone back where it needs to be, okay? So, although the declining levels of testosterone are normal with aging, many men fear andropause or, quote, male cessation, okay? The loss of muscle mass alone prompts men to search for solutions. Now, this is something for my young men. If you're 40 or less and you're bodybuilders, I really want you to listen to this, okay? Steroids help build muscle by increasing testosterone, but they deleteriously, I can't even say that word, affect the liver, the prostate, the heart, and the sex organs. So if you are using steroids to help bodybuilding, you are having an adverse effect on your manhood and your liver and your heart, okay? So we don't want to do that. Selective androgen receptor modulators are marketed to athletes and gym goers as an alternative to anabolic steroids. And we see this in the gyms. We do see these products that are marketed because it's supposed to enhance your workout, and so you're going to get more muscle mass because you're doing this. It hurts your prostate, it hurts your testicles, it hurts your heart, it hurts your liver. So be really, really careful about what you're doing with that, okay? Let's see. Okay, so this is interesting. How can you help your testosterone levels naturally? Well, we've got some products here that I'm going to talk to you about. But one thing that is very, very beneficial, and it has been studied, is intermittent fasting, okay? Intermittent fasting. Now, intermittent fasting means that you fast anywhere from 12 to 16 hours per day. Now that can include your sleeping hours. And so if you eat your meal early, your dinner meal early, and then you eat your breakfast late, you'll have a long time of fasting there, and so you'll be okay. So this is a way to maintain weight and testosterone levels. It also will help rebalancing your hormone. So fasting showed that it elevated your luteinizing hormone by 67%, overall testosterone by 180%. 180%, okay? That's a lot. And it enhanced the growth hormone secretion in men. So this is why you work out. This is why you take those supplements, because you want that strength and you want to have that muscle, integrity. And I appreciate that. I love the way you guys look when you work out and all that. But if you just do intermittent fasting, boom, you've got it. So we have this supplement. This is called Prost FX. This is really good if you've got testosterone issues. It helps the prostate do what it needs to do. We've got this herbal blend. We've got it in several different brands, but it is a male hormone blend, and so it balances you. It gives you more of the raw materials to make the raw testosterone. We've got Tribulus, which Tribulus is a plant, and it helps you make more of the free testosterone. It says this contains over 40% total saponins, which is the active component. The South Asian herb is popular for its potential role in supporting the reproductive function. Okay, so this means you're gonna have a good erection if you take this. I'm just throwing that out there. Now, if you have wimpy testosterone, if you've got the too much xenoestrogens in the blood, this is something called Privita, and it is an aromatase inhibitor, and it will stop that conversion. If you have erectile dysfunction, we've got this little happy thing for you, and it's called Herbal V, and that stands, I guess, for Herbal Viagra. They don't say that on the deal, but I'm just kind of having context clues here. And it's not very expensive, and we have a lot of men that come in here with a smile on their face, and they repurchase this time and time again. So we've got some help for you, but if you just do intermittent fasting, you're gonna just boost your testosterone levels. So I see I'm running out of time, so I want to get to my last topic, which is vitamin D. Now, vitamin D3 particularly, now there is a understanding that you can get a lot of your vitamin D from the sunshine, and yes, you can if you have enough cholesterol to metabolize it and turn it into what you need it to be for the body, and most of us do not. I'm just going to throw that out there. But this is a important thing. Vitamin D has found to be protective for colon cancer. So a lot of us are concerned about cancer. Colon cancer is one of the cancers that is on the rise. So I just want to throw this out there. In a recent study, a recent study has suggested that higher levels of vitamin D in the bloodstream may have a protective role against colorectal malignancy. In this study, people who had low levels of vitamin D had a 31% higher risk for colorectal malignancy, right? Those with higher levels of vitamin D3 had a 22% lower risk. So we all want to do what we can to lower our risk of all kinds of cancers. Now, on your blood work, everybody needs to look at your blood work. I've had time and time and time again that people come in and I'll ask them for their blood work, and I'll look at their blood work and I'll say, well, what did your doctor say about XYZ? Well, my doctor didn't say anything about XYZ. Why is that? Because XYZ is in the normal range. Well, holistic people have a different way of looking at that. And so while your medical doctor might not be concerned, I'm going to be concerned. So where vitamin D is concerned, a normal reference range in your blood work is 30 to 100 nanograms per deciliter. Thanks, Daniel. I appreciate that. Holistically, we want you to have above 60, and some of my holistic friends think that you need to have 80 or above. And so this is what we need to be able to help with you with your vitamin D. So we want to get your vitamin D levels above 60 nanograms per deciliter. So Kyle's saying it's berberine. Okay, berberine. Where did it go? Here it is. B-E-R-B-E-R-I-N-E. That is the spelling of that supplement. Okay, so the conclusion of this test, and this test, let me see who did this test. Does it say who the testing? Oh, yes, Institute of Medicine. Okay, Institute of Medicine. So this is what they say. In conclusion, for each 20 grams, For each 25 nanograms per deciliter increment of circulating D3, colorectal cancer was decreased by 19% in women, by 7% in men. And so what that tells me that colorectal cancer is more of a woman's disease than it is a men's disease, and it's probably because of what we eat and what we gravitate to. So if I want you to have your vitamin D3 at 60 nanograms per deciliter or better, you're really going to cut your chance of colorectal cancer by a significant degree. So I really, really want you to pay attention. It appears that the optimal vitamin D3 levels with reducing colorectal cancer risk would be above 75 nanograms per deciliter. So that's a lot. 75 is a lot. I will just tell you that mine is over 80, so I'm happy about that. And we have this awesome product. Now, I've talked about vitamin D before, so I don't want to go on long because I'm at my time limit, and I know people get bored. I've been told you get bored when I go over 30 minutes, so I'm trying not to bore you. This is what I like about this product. It's plant-based. It's got your cofactors in it. You either spray it under your tongue or inside your cheek. One spray is 1,000 international units. A healthy person needs 9,000 IUs in order to keep your vitamin D at optimal levels. So the doctor is going to prescribe you a 50,000 IU supplement that you take once a week. And why is that? Because it's a pill. It goes through digestion, it gets chewed up, it goes through the first pass of the liver, it gets chewed up, and whatever is left over makes its way into the kidneys where it is metabolized and put into the bloodstream. So they give you mega, mega, mega doses because they know it's not going to make the kidneys where it needs to be. This is a liposomal spray. It goes right into the cheek. And what we have found is people that come in with a low vitamin D, we do this for 60 days and it doubles their vitamin D. So, no waste, goes right into the bloodstream through the cheek or under the tongue, and it doubles your levels. So, this is what you want to do because vitamin D absolutely protects against cancer. It protects against the flu. It protects against depression. So these are my pearls for the week. It's the weekend coming up in just a couple of hours. Everybody's going to be like going on their whatever they do on the weekend. So love you guys. Thanks for joining me. I went a little bit long. Hope you stayed with me to the end. And I appreciate all the comments. And if I didn't see yours, didn't comment on yours, I will comment in the text. Love you guys. Have a great weekend. Be blessed.